Welcome to Amazing Grays. This show is dedicated to the idea that active, informed older adults are an essential part of today's society. We provide information regarding senior issues and concerns and salute individuals or groups who demonstrate that productivity doesn't end at retirement.
Welcome to another segment of Amazing Grays. I am so thrilled to have with us Dr. Stephanie Coursen from the Neck and Back Injury. Sorry, I didn't mean to say injury, but maybe it does happen, right? We're here to talk about osteoporosis and how it affects you in later life. You know that when you start off with soft bones, you really have a problem. So can you kind of tell us what osteoporosis actually is?
Yes, osteoporosis is a breakdown of bone tissue. It's actually a demineralization of bone tissue, and it can be diagnosed through blood work. A lot of times people will be diagnosed with osteopenia first, and then the next thing that you're diagnosed with is osteoporosis down the road. So you want to have x-rays taken to further verify if you have osteoporosis or not.
And who gets it? I mean, how old are you? I mean, are you young, old? Is this for a child? Is this for an adult?
It's typically not seen in children. It can start, though, as early as in your 30s. That's why it's important to know your family's history. If you have a grandmother or a mother or an aunt who's had it, you need to start paying attention to what you're doing in your daily life, because you are more prone to getting it. Just like some families are more prone to heart disease and diabetes, some people are more prone to osteoporosis. Also, people who have a sedentary lifestyle, bone forms through pressure, and if you're not getting the exercise that you need, you're going to be more prone to osteoporosis. One other group is menopausal women. Menopausal women have a decline of hormones that are responsible for building bone mass, and they also need to take measures to help to prevent osteoporosis.
Oh my. So how does a chiropractic help people who have osteoporosis?
Well, there are many things a chiropractor can do. We don't do the traditional chiropractic anymore on osteoporotic patients. It's not what their backs can handle when their bones are so brittle. A lot of our technique is based upon helping the patients with their muscle pain. We do therapies. If there are no fractures in the area, we can do therapies that help to loosen the muscles and get the blood flowing back to the muscles. We also do techniques such as myofascial release and trigger point therapy. They are forms of massage that also get the blood flowing to the affected muscle tissue and help to take toxins away and bring oxygen to the muscle. But most importantly, what we do are adjustments, and we adjust the areas of the spine where there's some nerve pressure. We don't do the typical cracking of the spine like the old-fashioned chiropractic. We use newer methods such as the activator. It's a little adjusting tool that very gently delivers a little impulse into the joint to relieve nerve pressure. We also have tables specially designed with drop pieces that allow just a little bit of movement into the joints to release nerve pressure also.
So what you're saying is at any given time, you could actually break a bone if you're full-blown osteoporosis patient.
Yes, because they're much more brittle. So anybody who has osteoporosis needs to take measures and start changing their routine and getting some exercise and changes in their diet.
Now, why do they have pain?
Patients that have osteoporosis, especially in the spine, have a breakdown of the bone tissue. The vertebrae in the back form together and form these holes where nerves come out. That's the brain communicates with the body through these nerves. When there's a breakdown of the bone, the hole isn't as big as it should be, and so wherever that nerve goes to, it's not receiving the full message, and as a result, you end up feeling pain, numbness, or tingling instead. This can not only affect muscles, but it can also affect organs. And a lot of times, patients who have osteoporosis will develop other system problems with other areas, and they don't even know what's causing it, but it's actually the pressure on the nerves. So the pain comes from the pressure on the nerves from the spine.
So does the lack of estrogen play a role?
Yes, actually the lack of estrogen is one of the essential things for bone formation. So if patients don't have the estrogen, they need to take measures, like I said before, and be exercising, get weight-bearing exercise, and be taking a supplement. The supplement that I recommend for that is calcium, magnesium, and vitamin D3. All three of those things are required for bone formation, and if you're not getting those in your diet, you need to be taking a supplement. And you can actually get this all in one pill at your local health food store or grocery store. And another thing that's important is sunshine. I know we don't get a lot of it here in Erie, but if it is a sunny day and it's warm enough to get outside, get some sunshine, because sunshine is what activates vitamin D3. So I typically recommend about 15 to 20 minutes daily. As much as skin as you can expose to the sun. If it's a warm day, expose your skin to the sun so that you activate that vitamin D3 to help to form bone.
Now, I don't think we mentioned what are some of the things that we can do to determine that a patient actually has gone into osteoporosis?
We can do blood tests, and we can also do x-rays. X-rays very, very definitively determine if a patient has osteoporosis, and you can see it right on the x-rays.
Okay, so that's like the bone scan?
Yeah, well, you can get traditional x-rays, a bone scan. There are different techniques to see this osteoporosis.
Now, what about nursing home patients? How does that,
I find them to be it's very, very important for them to be getting not exercise just 3 to 4 times per week like I typically recommend, but daily exercise, because they're not doing the normal things that most patients do in their homes, like taking out their trash, going to get their mail, cooking their dinners, cleaning their homes. So it's very important for them to be getting daily exercise. And it should be about 30 minutes on a daily basis.
Okay, now one question that bothers me is, once you get into the path of osteopenia and then on into osteoporosis, is there a cure?
There's not a cure, but you can help prevent it from worsening through exercise. Okay? Bone forms through pressure. And if you're not getting that exercise, you need to get out there and exercise for 3 to 4 times per week for 30 to 40 minutes.
Wow. We've covered a lot of little points. And is there something that you can leave our audience with that will help them, even taking a patient who has not gone into this type of lifestyle where they have to deal with worrying about the soft bones?
Right. I think I'd like to say to osteoporotic patients, first of all, there's help for improving the quality of your life. You don't have to live in pain. But if you're on the path, if you think you might be on the path towards getting osteoporosis, consult with somebody about getting on an exercise program and improve your nutrition and take the supplement that I've recommended. And if you feel pain from your osteoporosis, come in and get some treatment so that you don't have to live in constant pain.
Well, I sincerely thank you for coming and telling us all about osteoporosis. And at any given time, this is something that can develop.
Yes,
again, we thank you for coming.
Thanks, Joe, for having me.
Thank you for watching Amazing Grays. We are an all-volunteer organisation and are always looking for people to help us produce interesting programmes.